Imagine waking up one day and realizing that the world around you is starting to fade. Details becoming blurry, lights feeling too bright, or dark spots clouding your sight. For millions of people with diabetes, this isn't just a distant fear. It's a real and dangerous possibility. Diabetes doesn't just affect your blood sugar. It silently attacks your eyes, sometimes without any warning. What starts as a minor inconvenience, like occasional blurry vision, can quickly escalate into something far worse, even irreversible blindness. The most alarming part? Many people don't recognize the warning signs until it's too late. But today that changes. In this video, we're going to reveal 7 dangerous eye symptoms of diabetes that could lead to blindness. Some of these might surprise you, and one in particular, number 1 on our list, can go unnoticed until your vision is severely compromised. One of the most vulnerable parts of the body is your eyes, specifically the delicate network of blood vessels in your retina. When blood sugar levels remain too high for too long, these tiny vessels start to weaken, leak, or even become blocked. This can lead to a range of serious eye conditions, some of which may not show symptoms until significant damage has already been done. The good news? These conditions are preventable, but only if you catch the warning signs early. That's why today, we're breaking down the 7 most dangerous symptoms you need to watch for. If you notice any of these, it's time to take action before it's too late. Number 7. Blurry vision. Blurry vision might seem like a minor inconvenience, something you blame on fatigue or aging, but for people with diabetes, it can be an early warning sign of serious eye complications. When blood sugar levels fluctuate, they can cause the lens of your eye to swell, temporarily changing its shape and affecting your ability to focus. While this type of blurriness may come and go, repeated episodes could indicate underlying damage to your retina. Ignoring it now might mean facing more severe vision problems later. Unlike ordinary vision changes that improve with rest or new glasses, diabetes-related blurry vision can progress silently. If high blood sugar remains uncontrolled, the constant stress on your eye's blood vessels can lead to diabetic retinopathy, a condition where weakened vessels leak fluid or bleed into the retina. Over time, this damage can form scar tissue, pulling on the retina and distorting your sight permanently. In severe cases, it may even lead to retinal detachment, which can cause sudden and irreversible blindness if not treated immediately. To prevent long-term damage, the first step is to stabilize your blood sugar levels through a balanced diet, exercise, and medication as prescribed. Regular eye exams are also essential, as they can detect changes in your retina before symptoms worsen. If blurry vision persists or worsens, don't wait. Consult an eye specialist. Number 6. Dark spots or floaters. Have you ever noticed small dark spots, strings, or cobweb-like shapes drifting across your field of vision? These are called floaters, and while they're common as people age, their sudden appearance in individuals with diabetes can be a warning sign of internal bleeding in the eye. High blood sugar can weaken the tiny blood vessels in the retina, making them prone to rupturing. When they leak blood into the vitreous humor, the gel-like substance inside your eye, it creates these floating shadows that can partially block your vision. In the early stages, floaters may come and go, leading many to dismiss them as harmless. But as more vessels become damaged, bleeding can increase, causing a sudden shower of dark spots or even large areas of vision loss. This condition, known as vitreous hemorrhage, is a serious complication of diabetic retinopathy. If left untreated, excessive bleeding can cause scar tissue to form inside the eye, pulling on the retina and increasing the risk of retinal detachment, a medical emergency that can lead to permanent blindness. If you notice new or worsening floaters, don't ignore them. Unlike minor vision disturbances, diabetes-related floaters indicate active damage that requires medical attention. An eye doctor can perform a dilated eye exam to check for bleeding and, if necessary, recommend laser treatments or injections to stop further deterioration. The earlier you act, the better your chances of preserving your sight before the damage becomes irreversible. Number 5. Difficulty seeing at night. If you've noticed that driving at night has become more challenging or that dimly lit rooms seem darker than before, it might not just be aging. it could be a sign of diabetes-related retinal damage. The retina relies on specialized cells, called rod photoreceptors, to adjust to low light conditions. However, high blood sugar can gradually impair these cells, making it harder for your eyes to adapt in the dark. This can lead to delayed night vision adjustment, making activities like driving or walking in poorly lit areas dangerous. As this condition progresses, navigating at night may feel increasingly hazardous, especially when encountering glare from headlights or struggling to distinguish objects in shadows. Over time, this difficulty may signal diabetic retinopathy or even early-stage cataracts, both of which are more common and develop faster in people with diabetes. Cataracts cloud the lens of the eye, reducing the amount of light that reaches the retina, while retinopathy damages the blood supply needed for clear vision. The combination of these issues can severely affect depth perception and contrast, increasing the risk of falls or accidents. Addressing night vision problems early is crucial. While wearing anti-glare glasses and increasing ambient lighting at home may provide temporary relief, the real solution lies in controlling blood sugar levels to slow retinal damage. Regular eye screenings can also help detect early changes, allowing for interventions like specialized eye drops, laser treatments, or cataract surgery if necessary. If night blindness is becoming a persistent issue, don't wait. Seek professional care to prevent further decline in your vision. Number 4. Sensitivity to light. If you find yourself squinting more than usual in daylight or feeling discomfort when exposed to bright lights, your eyes may be sending an urgent warning. Light sensitivity, also known as photophobia, can develop when diabetes starts affecting the nerves and structures within the eye. Fluctuating blood sugar levels can lead to inflammation, disrupting the way your pupils adjust to different lighting conditions. Over time, this can cause an exaggerated reaction to brightness, making everyday activities, like stepping outside or using screens, uncomfortable and even painful. One of the most concerning causes of light sensitivity in diabetics is diabetic neuropathy affecting the optic nerve. Just as diabetes can damage nerves in the hands and feet, it can also impact the optic nerve, reducing the eye's ability to regulate light properly. Additionally, early-stage cataracts, which develop more quickly in people with diabetes, can scatter incoming light, making glare feel much more intense. If left untreated, these conditions can progress, further distorting vision and increasing the risk of blindness. To manage photophobia, it's essential to address the root cause, unstable blood sugar levels, which can worsen nerve damage over time. Wearing UV protective sunglasses, using blue light filters on screens, and avoiding overly bright environments can provide relief. However, if sensitivity worsens or is accompanied by vision changes, consulting an eye specialist is crucial. Early intervention can help prevent permanent nerve damage and protect your long-term eye health. Number 3. Eye pain or pressure. Eye pain is not a typical symptom of vision changes, so when discomfort or pressure builds up in your eyes, it's time to take it seriously. For people with diabetes, this could be a sign of increased intraocular pressure, which can indicate the onset of glaucoma, a condition where fluid builds up inside the eye, damaging the optic nerve. Unlike other vision problems that develop gradually, glaucoma can steal your sight permanently if not treated in time. Many people don't realize they have it until vision loss begins, making early detection critical. Aside from glaucoma, eye pain in diabetics can also be caused by diabetic neuropathy affecting the ocular nerves. This nerve damage can lead to a dull, aching sensation in the eyes, or even sharp pains when moving them. In some cases, poor blood circulation caused by diabetes can reduce oxygen flow to the optic nerve, triggering inflammation and discomfort. Ignoring persistent pain can be dangerous, as it may signal that the underlying damage is progressing toward irreversible vision impairment. If you experience eye pain or pressure, don't assume it's just strain from screens or fatigue. Immediate medical evaluation is necessary to determine the cause and prevent further damage. Treatments like prescription eye drops, laser therapy, or even surgery may be required to lower pressure and protect your vision. Managing blood sugar levels also plays a crucial role in preventing these complications. Remember, pain is your body's way of warning you. Don't wait until it's too late to listen. Number 2. Persistent redness and irritation. Occasional eye redness might not seem like a big deal, but when it becomes persistent, accompanied by irritation, a burning sensation, or excessive dryness, it could be a sign of underlying damage linked to diabetes. High blood sugar levels can disrupt the tear glands, leading to chronic dry eye syndrome, where the eyes fail to produce enough moisture. This lack of lubrication causes redness, discomfort, and an increased sensitivity to wind, smoke, and screens, making daily activities like reading or driving more difficult. But dry eyes are only part of the problem. Diabetes can also weaken the blood vessels in the conjunctiva, the clear tissue covering the white of the eye, causing them to become inflamed or even burst, leading to frequent redness. In more severe cases, prolonged irritation can make the eyes more prone to infections, as the protective tear film is compromised. If left untreated, ulcers or scarring on the cornea can develop, potentially leading to permanent vision loss. To manage this, it's crucial to keep blood sugar levels stable and use artificial tears or lubricating eye drops to relieve dryness. Limiting screen time, staying hydrated, and avoiding irritants can also help. However, if redness and irritation persist, especially if accompanied by blurred vision or pain, a visit to an eye specialist is necessary. Treating the root cause early can prevent more severe complications and keep your vision clear and comfortable for the long term. Number 1. Gradual loss of vision. Losing vision slowly over time can be one of the most dangerous and unnoticed symptoms of diabetes-related eye disease. Unlike sudden blindness, which demands immediate attention, gradual vision loss often develops so subtly that people don't realize the extent of the damage until it's too late. This is commonly caused by diabetic macular edema, DME, or advanced diabetic retinopathy, where prolonged high blood sugar levels lead to fluid buildup or severe damage to the blood vessels in the retina. As these conditions progress, fine details become harder to see, colors appear faded, and blank spots may begin to form in your vision. Another major cause of vision loss in diabetics is progressive glaucoma, a condition that slowly damages the optic nerve due to increased pressure in the eye. Unlike other eye problems that affect central vision, glaucoma typically starts by stealing peripheral vision. Many people don't notice until their side vision has significantly deteriorated, and by then, the damage is often irreversible. This is why glaucoma is sometimes called the silent thief of sight. Without early intervention, it can lead to complete blindness. The key to preventing permanent vision loss is early detection. Regular comprehensive eye exams, including retinal scans and intraocular pressure tests, are critical for catching issues before they escalate. If you're experiencing fading vision, dark areas in your sight, or difficulty recognizing faces, don't dismiss it as aging. Seek medical help immediately. Your eyesight is irreplaceable, and taking action now can mean the difference between maintaining your vision and losing it forever. Diabetes can silently damage your eyes, but recognizing the warning signs early can save your sight. Blurry vision, floaters, night blindness, and gradual vision loss are not just inconveniences. They could signal serious complications. If you've noticed any of these symptoms, don't wait. Schedule an eye exam and keep your blood sugar in check. Early action is the key to preventing blindness. Stay informed, take control, and protect your vision for the future.